Good morning, members of the CNMI legislature. My name is Jiwon Moon. I'm a registered nurse with experience in surgical nursing. I'm here today to express my strong support for the Public Law 23-13, which ensures the payment parity for telehealth services in our community. This law is very important because it makes telehealth services reimbursed at the same rate as in-person visits, which means that it eliminates financial barriers for healthcare providers, especially in our areas like medically underserved, where access to specialists can be limited. So by reducing the financial burden for the healthcare providers, this will actually expand for the services of a virtual care. Based on my experience, it is common to see patients in our community having a hard time meeting up their doctors and scheduling their appointments due to a shortage of specialists as well as with financial barriers. According to the study, telehealth is a proven solution for this kind of matter, which improves the access to care, lower costs, and leads to better outcomes as well. Um, in the community, we have some issues with the mentally ill patients and behavioral issues as well. So one area will be impacted for this virtual care will be a mental health. With a few mental health professionals here, telehealth will be a great option to connect the patients with the care they need. So telehealth also helps to reduce the stigma around like seeking mental health support in the small communities. This law will also support the continuity of care, which means that it allows patients to have a regular follow with their doctors, and then also the regular management with a chronic disease. So through a virtual care. So for those with the mobility issues or the chronic conditions which makes them hard to travel to the hospital, telehealth will be also make it easier for them to have a regular access with the doctors as well. So while Public Law 2313 is a big step forward, I encourage you also to focus on improving broadband infrastructures, which is a key to make telehealth work more effective in a remote area. So for example, we need a good internet connections. We need also a public education for the providers as well in order to establish the right telehealth services. So so for overall, Public Law 23-13 is an important step in making healthcare more accessible for everyone, especially in the underserved areas like us. So it will improve mental health care, reduce healthcare costs, and enhance overall patient outcomes. So I strongly urge you to continue supporting telehealth initiatives and take additional steps to make virtual care even more effective for our community. Thank you for your time and thank you for listening. I'm happy to answer any questions if you may have. If not, thank you.